Hi, good morning. Nancy with the Hospice Care Plan. Here's the thing about death. There's no real rule book. Those of us who work in hospice care know that it's still a mystery. It will always be a mystery until we're actually going through it ourselves. So what we do is we give the bell curve what we know and what we expect based on our experience. I have a family right now who is so struggling with the loss of their mom because she's outside of the rule book. Generally, transition is 4 to 14 days, and that's when the body is getting dry and comfortable and getting quiet and sleepy. And then it's not until the last 1 to 3 days when a patient generally is in that active dying stage. Well, this gal is outside of both of those. She's very strong in many ways, and it's been really hard on the family who have been in vigil all around her bed together in her home for all of this time. They're exhausted, they're ambivalent. They want their mom to be comfortable. At times, there's a little uprising and they go, oh my gosh, she's getting better. What can we do to make her better? Well, there is nothing to make her better. It's just following her. I always tell my patients that the patient is the leader. My job is just to walk with the patient, to follow them, to make sure they're comfortable, and to support everyone. Hold the chalice of all of that emotion as the patient is declining. I often look at my families and think to myself with such compassion that it's the families and the loved ones who have the harder job to sit and watch their loved one dwindle away. Whereas the patient, they know what they're doing. I always tell my families, they're ahead of us. They are right there knowing what their path is and that death will come. And what are we all afraid of? I think they say in the public that the two most important things that we're afraid of is public speaking and death. And I'm not sure which order, but everyone is not, is afraid of death in one sense, but it's usually how they're going to die and not dying. And I do tell my families, remember, you've been really afraid of death, but once that death occurs, that takes that fear away. So there's a blessing in death as well. Let's walk with our clients. Let them know that what they're doing is blessed work. And let them know that eventually the mystery will take care of itself. And then it's a new chapter. They'll have to turn their compassion and love and hopefully upon themselves and the loved ones in their family so that they can move through the next chapter and provide all that loving care to each other.